I guess I missed the signs, being a tough guy, not wanting to go to the doctor. And the doctor told me that I've had kidney failure. He said, you either do dialysis or, Mr. Dallas, you're gonna die. After I got the kidney transplant, I had to eat different, I had to think different, I had to work different, and I learned, the type of foods that I needed to eat to help me for this and that. And I read and I studied about my condition and what I needed to do to get better and how important it was to eat the right foods. I got a couple of these, a few of these growing at home.
We know when someone is coming out of a healthcare crisis of some sort, long-term viability and capability is largely dependent on nutrition. So our theory was, let's build a food RX program, something we would take for granted, and make that available for individuals and families at a much larger scale.
Nutrition is playing a great part, a big part, a major part in me keeping this kidney and staying healthy. Now I'm familiar with everything that I consume, everything that I drink. I can't eat grapefruits for one anymore, which I love, but staying alive and being healthy is more important than what I miss eating.
The Tampa Well Community Garden and Food Pharmacy was our first real big initiative under the Tampa Well umbrella to have a positive impact on the East Tampa community, as well as to positively impact our patients here at Health Park.
Actually, I live in this neighborhood, probably about 3 blocks from here, for over 35 years. I have my primary care doctor here, which refers you to the program here, and they monitor your intake.
What you see today is a 1-acre garden connected to a primary care facility along with a food pharmacy. And the food pharmacy is an opportunity for us to really systematically prescribe food as medicine to our patients. So our patients now are being screened for food insecurity.
One, you don't have to pay for the food, and food is very expensive, especially fruits and vegetables. And a lot of people don't have access to that, or they may not buy those items to eat. I have a low dosage of hypertension. I try to monitor the salt, and I use onion powder and use vegetables.
So if they're identified as being someone who needs a little bit of additional support in that area, they receive a prescription from their provider to come join us at the food pharmacy once a week for 6 months to pick up fresh produce along with shelf-stable items to really support the management of their chronic condition and to hopefully have that positive impact on their health and well-being.
Food is a pathway to health. That's how we see that, and combining the two and then working with other partners to bring that full circle, we think creates a pretty thoughtful and innovative outcome.
We partnered with a fabulous local muralist to come up with a design that really reflected the community that we were impacting. And then we had over 500 volunteers come out to paint by numbers, and they were able to really leave behind a little piece of their heart to be part of the food pharmacy.
This is amazing. I come here once a week, which I love, because I can watch things grow, and which I do at home. And these smell great. I'm a very good cook. Every now and then I'll deviate, and every now and then I'll eat a tomahawk, steak.